Hey everyone. We're talking about diabetes today, specifically those sneaky symptoms that flare up at night. These nighttime symptoms, if ignored, can lead to serious complications like nerve damage and heart issues. Let's go over 15 nighttime diabetes symptoms you absolutely cannot afford to ignore. Let's talk about waking up drenched in sweat. This can be a sign of nocturnal hypoglycemia or low blood sugar while you sleep. If it's a regular occurrence and you're also experiencing dizziness or confusion, it's time to talk to your doctor. Managing diabetes is a 24/7 job, even when you're catching those Z's. Are you making frequent trips to the bathroom in the middle of the night? Excessive urination, especially at night, is called nocturia, and it can be a sign of high blood sugar. This constant need to pee can disrupt your sleep and dehydrate you, making your blood sugar levels even more unstable. If you find yourself constantly running to the bathroom at night, get that blood sugar checked. Waking up thirsty in the middle of the night is one thing, but feeling like you just crossed the Sahara Desert, that's a whole other level of thirst. For people with diabetes, it could be a red flag that your blood sugar is through the roof. If you're constantly waking up with a parched mouth and an unquenchable thirst, don't ignore it. Talk to your doctor, get your blood sugar checked, and stay hydrated. Let's talk about those annoying leg cramps and that irresistible urge to move your legs at night. For people with diabetes, this could be more than just restless leg syndrome. It could be a sign of nerve damage, also known as diabetic neuropathy. If you're constantly kicking off the covers because of restless legs or painful cramps, don't just try to sleep it off. Talk to your doctor about managing your diabetes and protecting those precious nerves. Ever wake up in the middle of the night and feel like your hands or feet have gone to sleep? That pins and needles sensation, or even complete numbness, can be another sign of nerve damage related to diabetes. If you're noticing it regularly, or if it's accompanied by pain or weakness, it's crucial to see your doctor. Early detection and management of diabetic neuropathy are key to preventing further nerve damage. We all have those nights where sleep seems impossible. For people with diabetes, difficulty falling asleep or staying asleep could be linked to fluctuating blood sugar levels. High blood sugar can lead to frequent urination, making it hard to fall asleep or stay asleep. If you're constantly struggling to get a good night's sleep, it might be time to take a closer look at your blood sugar control. Talk to your doctor about ways to manage your diabetes and improve your sleep hygiene. Imagine waking up suddenly in the middle of the night, gasping for air. For people with diabetes, it could be a sign of obstructive sleep apnea. People with diabetes, especially type 2, are at a higher risk of developing sleep apnea. If you're experiencing loud snoring, gasping for air at night, or excessive daytime sleepiness, don't wait to get checked out. Talk to your doctor about sleep apnea and its impact on your diabetes management. We've all experienced that groggy feeling when we first wake up. But waking up with dizziness or a pounding headache, that's a different story. For people with diabetes, these morning symptoms could be a sign of nocturnal hypoglycemia or high blood pressure. If you're regularly waking up feeling dizzy, lightheaded, or with a pounding headache, don't just pop a pain reliever and move on. Talk to your doctor about getting to the root of the problem. Managing your diabetes effectively can help alleviate these symptoms. We're used to our vision being a bit blurry when we first wake up, but what about experiencing blurry vision specifically at night? High blood sugar levels can cause the lenses in your eyes to swell, distorting your vision. Persistent or recurring blurry vision can be a sign of diabetic retinopathy, a serious complication of diabetes. If you're noticing blurry vision at night, schedule an appointment with your eye doctor. We all have weird dreams from time to time, but if you're consistently having nightmares or unusually vivid dreams, it might be your body's way of trying to tell you something. Nightmares and vivid dreams can be a warning sign of nocturnal hypoglycemia. If you're having them frequently, mention it to your doctor. We've all been there. Those late-night cravings that send us rummaging through the pantry. For people with diabetes, unexplained nighttime hunger could be a sign of insulin resistance or blood sugar fluctuations. If you're finding yourself constantly raiding the fridge in the middle of the night, don't ignore it. talk to your doctor about getting your blood sugar levels checked. Have you ever woken up feeling like your heart is racing or pounding in your chest? For people with diabetes, they could be a sign of significant blood sugar fluctuations. Frequent or persistent palpitations warrant immediate medical attention. We all wake up with a little dragon breath sometimes. But for people with diabetes, persistent dry mouth and bad breath could be a warning sign of diabetic ketoacidosis, or DKA. If you experience persistent dry mouth, fruity-smelling breath, or any other symptoms of DKA, don't wait. Call 911 or get to the nearest emergency room right away. We all have those mornings when we just can't seem to shake off the sleepiness. But if you're consistently waking up feeling exhausted, it could be a sign that your diabetes is not well controlled. If you're chronically waking up exhausted, talk to your doctor about your diabetes management. They can help you identify potential causes of your fatigue and get you back to feeling energized. Waking up confused or disoriented can be a frightening experience. For people with diabetes, it can be a sign of severe hypoglycemia, a medical emergency that requires immediate attention. Call 911 or get to the nearest emergency room as quickly as possible. So there you have it, guys. 15 nighttime diabetes symptoms you absolutely cannot afford to ignore. Managing diabetes is a 24/7 job, and that includes paying attention to what your body is telling you, even while you sleep. If something doesn't feel right, don't hesitate to reach out to your healthcare provider. And as always, stay happy and healthy.